So my name is Bridgette Hempstead, and 21 years ago on my 35th birthday, I was diagnosed with breast cancer. And prior to that, I had to advocate for myself to get a mammogram. And the doctor didn't want to give me one. She said, for one, you're too young, and she gave me a laundry list of reasons why I didn't need to get a mammogram. The last one was the most disturbing because she said, you are African American, and African Americans don't get breast cancer, so come back in 10 years.
And I was diagnosed in 1992 with breast cancer on the right side, and I had a double lumpectomy. And after that, I had 6 months chemo and 3-month radiation. I didn't even know what questions to ask. They didn't even give me a chance to say if I wanted a mastectomy or anything. They just did what they did and told me that's what they were doing.
Finding out that there was no resources and there was no one that looked like me in the city, and everything that I saw on TV about breast cancer was always white women and the races and the pink. And so on the third day after the diagnosis, I said, I've got to do something. I've got to educate my community, because how many women are out there that are Black that are dying?
When I was diagnosed, no one really talked to me. I got no information about what I could eat, what I couldn't eat. So I had a really hard time when I was doing my chemotherapy.
While I was bandaged up, my doctor started sending women to me, and they said, you know, we have a woman who's been newly diagnosed and she did not take it like you. Would you talk to her? And so I said, of course I would.
I didn't want to go to a group or a support group because I didn't want to be like, woe is me and a pity party. But then when I met Bridgette one day, we were at a health fair. She was speaking then. I got to talking with her, and she just said, just come to one meeting so you could see for yourself.
From there, my reputation grew in the medical community, and doctors and other healthcare members began to send women to me. So it was overwhelming, you know, always talking to someone every day about it and how to get through the process and how to talk to the doctors, that I started meeting with them at Starbucks in a group.
What I tell women now that are newly diagnosed and everything, make sure they ask all the questions they need. Don't be afraid to talk to someone. Don't keep it to yourself.
Cierra Sisters was born out of frustration because a doctor told me Black women don't get breast cancer. The frustration that these big organizations didn't take the time to say, let's include Black women in clinical trials. Let's include Black women in our education. I want to push people of color to go into research, become a doctor, become a specialist, because our community needs that. And that's what Cierra Sisters is. You've got knowledge, you've got power, you've got self-esteem, you got to strut in your stuff, you know? And so that's what we do.